Assalamu alaikum wa rahmatullahi wa barakatuh. This is Dr. Sana. Welcome back to my channel. Today we are going to discuss about inguinal hernia in men, which is a common condition that is we usually get in clinical conditions, or which is a common issue found in men, which we used to get in clinical conditions or clinical practice. Let's look into what is inguinal hernia. An inguinal hernia happens when a part of the intestine or fatty tissue pushes through the weak spot in the lower abdominal wall into the groin, or we can say it as inguinal canal or inguinal area. It is one of the most common type of hernia in men. Let's look into where it occurs. It occurs in inguinal canal, a natural passage in the groin where the structures like a spermatic cord passes. Men are more prone because this area is naturally weaker. So, the area where inguinal hernia occurs is the V line of the lower abdominal area here or here. The bulging occurs over here or here. Okay. So what happens in inguinal hernia is the part of your intestine or fatty tissues. There is a canal inside over here, and a part of your intestine or fatty tissue pushes to that canal, and it causes a bulging over here. This is the V line. You can easily identify it as a V or as the V line, the line of V in your body at the lower abdominal area. So, types of inguinal hernia. There are two types of inguinal hernia. One is indirect inguinal hernia and direct inguinal hernia. The first one, indirect inguinal hernia. It is most common, often present from birth as a natural opening, didn't fully close. The second one is direct inguinal hernia. It develops later in the life of a man due to the weakening of the lower abdominal muscles in his later ages of life. Let's look into the symptoms of inguinal hernia. What are the common signs or common symptoms that presented in inguinal hernia? Common signs are the bulge in groin, more visible when standing or coughing. Here, this area, bulge in the groin, more visible when standing or coughing. Discomfort or pain in the groin area. Okay. Feeling of heaviness or pressure over there. Okay. In some cases, it can extend to swelling in the scrotum. So, let's look into the warning signs. What is mean by warning signs is, if you see these signs, you need an urgent medical attention. So let's look into what are the warning signs. Sudden severe pain, nausea or vomiting, bulge become hard and cannot be pushed back. Okay, these may indicate complications like strangulations, which is a medical emergency condition. So you need an urgent medical attention at these cases. Okay, now let's look into the causes and risk factors. Heavy lifting, chronic cough, constipation or straining for a long time, obesity, aging, which causes muscle weakness, or family history. These are the causes and risk factors. Now let's look into the diagnosis. Doctors usually diagnose it through physical examination and sometimes imaging like ultrasound or CT scan. Many cases, as the age advances, many men notice some small painless bulging over there, as the muscle weakness over here advances and the small bulging can be noticeable, or sometimes some men didn't even notice these swelling. They will only find out these kind of swellings while physical examination. So in small painless hernias or painless swellings, watchful waiting is enough. Second option is surgery, that is definitive treatment. If the condition is serious and the doctor identify it as serious condition and needs a definitive treatment, they will advise for surgery. Hernia repair surgery is the only permanent fix. Types of surgeries are two types: open repair and laparoscopic or minimal invasive surgery. What happens in this case is often involves placing a mesh to strengthen that area. Let's look into the recovery period. Light activity can do within weeks, within few days after surgery. Full recovery needs 2 to 6 weeks, depends on the surgery type. Now, prevention tips: avoid heavy training, maintain healthy weight, treat chronic cough, eat fiber to prevent constipation, use proper lifting techniques. So, the key point you should note that inguinal hernia is common and treatable condition, but it should not be ignored, especially if the symptoms worsens. So take a note of these knowledge and consult your physician or your medical provider if you have these conditions. That's all about today's topic. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.